Is it just a jigsaw puzzle in trauma? Now, X-rays of this 55-year-old female were sent to me. The relative brought this X-ray, and as a trauma surgeon, we often work at spinal level, and then I started thinking, isko nail karu ya plate karu? Soon I realized that these X-rays belong to a 55-year-old female patient with all these deformities, who has never walked in life, a case of osteogenesis imperfecta with bilateral subtrochanteric fractures. Left side was acute, she had fallen down from a bed, and on the right side, it was a 30-year-old non-union. And you can see she had several deformities. You can see the left leg totally deformed, right leg almost a U deformity, right humerus, and multiple fractures of the spine. A challenge from all point of view. And she had never walked in life. She had limited expectations. Basically, she wanted pain relief because the subtrochanteric fracture was causing tremendous discomfort. She also wished to have some deformity correction and wanted to have at least mobilization, at least on a wheelchair. For the subtrochanteric fracture, these challenges were significantly bowed femur, severe osteoporosis, short femur, narrow canal, and multiple deformities. So the planning was have a lateral position on plane table, because obviously we could not put her on fracture table, osteoporotic bone, so an intramedullary implant, bowed femur, osteotomies and wedge resection, and narrow canal and short femur, humerus nail for femur. Challenges and planning for that, it was a solid nail, so my first chance would be my best chance. Difficult to anticipate the final length of nail because I would be excising segments and I would be doing osteotomies. So my planning on paper has to be perfect, and straight nail is likely to perforate, and therefore my osteotomies have to be recurvatum osteotomies so I can pass a straight nail. So that was the planning on table. I calculated the length of the nail and diameter of the nail, lateral position. So we did a proximal wedge resection and inserted the nail from just medial to GT. Then decided to have osteotomies as and where needed. And this is after the second osteotomy. And after passing the nail, proximally we had spiral blade and a screw, and that is why the humerus nail was better, and then distal locking. So here you can see the recurvatum osteotomies as planned. Her pain reduced immediately, hip and knee mobilization could be started. She started sitting up comfortably, and we started her on teriparatide. This is at 1 month, this is at 3 months. At that time, she requested for deformity correction of the tibia. Here you can see that's the apex of deformity, and that is where the tibia is completely rotated at 90 degrees. After doing a similar procedure, fibula osteotomy and deformity correction and insertion of humerus nail in anterior-posterior direction. This is before and this is after. At 10 months, you can see the femur has excellent healing and correction of the deformity. This is the leg deformity before and after. And then we address the non-union of subtrochanteric fracture on the right side. As you can see here, we tried the similar procedure. There was a crushing of proximal segment of the femur, and of course the nail could have been little shorter. So this is where the planning went off a bit haywire. In stage 2, as you can see, she has a U-shaped tibia, and she had opted for a below knee amputation. So we did a below knee amputation, used that fibula, which was pretty thick, for bone grafting of the right subtrochanteric femur and left tibia. And this is 3 months post-op where the fracture started healing. And you can see all the fractures have consolidated, all the deformities are corrected. This is 24 months after femur fixation. This is 16 months after right subtrochanteric correction and fixation, and this is 21 months after the left tibia fracture union. So here you can see she's comfortably being mobilized on a wheelchair with leg dangling and smiling. Friends, it is said that make time for planning. Stephen Covey has said, make time for planning. Wars are won in general tent and not on battlefield. Thank you, friends.